here from Beat and Jeans, and today we are interviewing Nicole, or the Gutless Nurse, about her BRCA CDH1 mutations. She's had a bilateral mastectomy and gastrectomy, so we have a lot to talk to her about. So I'm going to go ahead and invite her in here. Okay. Hope you're all having a good day. Had a good Valentine's Day. Here she is.
Hi, Nicole. How are you?
We're good. How are you?
I'm good, thank you.
Good. Where are you coming from?
Pittsburgh.
Wow.
Yeah, so just woke up though too. Worked a little bit last night, so.
Oh my gosh. So you have the night shift?
Yeah, I rotate.
Okay.
But mostly
And you're a nurse. What department do you work in?
I used to be a pediatric nurse in the ICU and NICU, and then I recently just switched to orthopedic.
Oh, wow. That's quite different.
Right. My patients talk to me, so it's a little different now.
Yeah.
Did you have to orient to the new unit?
No, they just get on in there.
Wow.
Yeah.
Very different.
It's always learning, so.
Yeah,
nice.
That's right.
We're so excited to be talking to you today. Can't wait to hear all about what you've been through.
Yeah, it's been actually today. Yeah, it's like I think my 3-year anniversary of my gastrectomy.
Wow.
Today is?
Today is, yeah, the 15th.
Wow.
So, because I remember eating a big Valentine's dinner the night before, so I could.
Oh, yeah, it is. Wow, 3 years. So you've got a lot to tell us and a lot to teach us, I bet.
Right. At first, well, 3 years ago, like it was just it hit me. I knew that I was CDH1 positive for maybe like 5 years prior to getting the gastrectomy, just because it was a fluke. We found out on a fluke. Like I went to my annual appointment, and with my family history of breast cancer, my doctor at the time said, hey, why don't we just do one of those BRCA tests? And well, the test that they did had a slew of genes that they were testing for. They just happened to drop it off or whatever. So I ended up testing, forgot about it because it was like 3-4 months before all this came back to me. And they just called and said, hey, we got your results. So we'll send them out in the mail from the lab and just follow up with what the paper says, because nobody knew.
Oh my.
This
was like kind of new?
New, like nobody, because I went like 2 hospitals here in Pittsburgh. Well, I'm a little south of Pittsburgh. The local ones really haven't heard of it before, and they just did what was recommended. I had a mammogram, I had a colonoscopy, and I had an endoscopy, and that's fine. I think I was probably like 29, because I was going to start at 30 anyways because of the family history of getting mammograms. But when I started working at West Virginia University, so many years later, the gynae there was quite familiar with it. So she's like, how long have you known that you had this? And I was like, years, like a couple years. And she's like,
you're talking about CDH1 or BRCA?
CDH1. Like BRCA, nobody did any, we just had to keep up on the scanning.
Okay.
So I remember my first visit with them just because my insurance changed. So I had to stay in that state. And then they rocked my world, because that was Halloween. I remember it being Halloween and my birthday is November 15th. So she just laid it out on the table for me. She's like, well, I need you to see a genologist. We have a surg-onc that's really good. And I'm like, wait, what are you talking about? You know what I mean? What?
Because you hadn't like looked into it yet. Did you Google it?
I Googled it, and I was like, what? You know what I mean? Well, if they don't care, you know what I mean? Like, then, I mean, we already did what the paper said. We already did my colon. We already did my endoscopy, got biopsies fine, did my mammo. But nobody seemed worried about it.
Right.
And I was like, what do you mean? You know what I mean? So the very next week, I seen the genologist, and I think surg-onc at that time. Like, they just came in and they really they said about 90% before your 37th birthday have stomach cancer.
Right.
Oh my God.
And I was like, my birthday was the 15th. Yeah, so it's like in 2 weeks. And I think I was, well, how old am I now? I think I was turning like 33, 34.
Oh.
And I was just like, what? You know,
Yeah.
like nobody in my family. And then as I explained it to my family, my grandma was like, well, so-and-so had this. And I'm like, well, that's nice to know now, you know, like, but
Oh, really?
Was there
yeah,
was stomach cancer?
stomach
in there?
cancer.
Okay.
Yeah, there was stomach cancer. And of her down like my great uncles and stuff like that.
Right.
Nothing real close to home,
Whoa.
just breast cancer. She had breast cancer. And I was like, okay. So I went home, told my husband, and I still had one more appointment the following week to meet with the breast specialist and the gynecologist again.
Mm-hmm.
And when I met with them, I was allowed to bring my husband because this is all pre-COVID. So you were allowed to have people there.
Yeah.
Thank gosh. But I brought my husband, I brought my mom and everybody, and they then told me that not my stomach needs removed and my breast.
Oh, wow.
And that's
They said both.
yeah. And I was just, I didn't hear anything else. I was like, so what's left of me? You know what I mean? Like I'm
True.
I'm young. I'm like, what's left of me? And that's when my husband like looked at me and said, your life.
Mm-hmm.
You know, and then it just started crying. It was just an emotional toll. And then
Yeah, that's a lot. That's a lot at once, right?
yeah, and then I have two children. They're now 5 and 11.
Mm-hmm.
One girl, and back then Gabby was probably like 2 or 3. And you can do whatever or say what, I'll go through anything. But when they told me that my children need to be tested at 18 because it's 50%
Oh,
hereditary, it still hurts me. You know what I mean? Like, but she doesn't understand. She thinks that, did you get your new stomach today? And I was like, no, Gab, we'll wait on that, you know. But my son, he's older. We were always very truthful with him because I was going to be in the hospital for a while. He asked all the time, like, hey, do I have to get my belly removed too?
Oh.
I said, we'll cross that road when it comes, you know.
Oh, that just breaks your heart. Oh.
You can do anything you want to me, just
Yeah. Right.
looking at them, you know what I mean?
Right.
So I was just completely blindsided because nobody mentioned or cared about this gene, you know what I mean? And like I've heard, you know, and then all of a sudden, like, you mean like, because when you tell people, they're like, oh yeah, gastric bypass. I'm like, no,
right. They do say that.
Yeah. I'm like, no, it's gone. Like,
and they're like, oh, good. Oh, you're going to lose weight. It's like, no.
I wish I could be skinny or eat whatever I want. I'm like, oh, I don't eat whatever I want. I wish I could eat ice cream again. I wish you know, but yeah, it's straight esophagus to small intestine.
Did you make up your mind that day? Or were you like, I don't know, I think I'm going to do a little bit more research? Or did it scare you into the, like, I need to do this for my kids and my family?
That was the big goal. Because on the way home, we were completely quiet. Because it was like, we live an hour away from work. Because I worked out.
Yeah.
And later that night, like, of course, you just keep thinking about it. It doesn't stop. And I talked to my husband. I'm like, what do you think? He's like, you do what they say. Like, he just didn't care. You know what I mean? Like, you do what they say. And then more I researched it, and it was all just coming back to the gastrectomy and being a provider, you know, like just doing what you can. And I was trying to, like, well, being in the health field, like, I know that if I got breast cancer anywhere, you can treat that. Like, it's a tumor. As to where the stomach, I was trying to explain because a lot of people were against me doing it.
Mm-hmm.
And I was like, they're like, I just don't understand why you have to do this. I'm like, you don't have it yet. I'm like, yeah, but when it comes, if it comes,
right,
you can't, it's gone. Like, it just blows through the lining of your stomach. You can't treat it.
We know that, it cannot be diagnosed or they oftentimes don't see it until it's at a later stage, right?
Right. Like, it's too late by the time they, you know, so, and then that was November. So come February, February.
Wow.
Yeah. My doctor, loved him. He was no mess around. You know what I mean? He gave it to you straight. Like, he was still compassionate, but at the same time, like, because being a nurse, I'm just like, yeah, you know, like, I'll look it up on my own, or it'll come, you know, because I take care of everybody else but yourself. And
Right.
tough love came in from the doctor, and he was like, no, we're doing this and you need to do it now because it's just another year. You know what I mean? I was like, okay, let's do this. But
And
then
you were in West Virginia. That's where you had your surgery. What
yeah,
hospital?
Ruby Memorial.
Okay. And they
So,
were familiar with the whole CDH1 and how to do the surgery and all that.
yeah, Dr. Tomei was excellent because like he actually told me he had an 18-year-old that had it, and he deemed it the lonely disease because
He had a patient, maybe.
he had a patient already.
Oh, okay.
Sorry, the patient. He had an 18-year-old that had it.
Okay.
And he was quite familiar with it, and which made me feel so much more comfortable. But he did deem it a lonely disease because like nobody knows about it, and the things you go through from your ups, your downs to like it's just different. You can't explain it to somebody that doesn't have it. You know what I mean? So yeah, he was tough loving, and we got it done. But I would like to say what all went up from there, but it didn't because
No. We've seen that looking at your Instagram that you had a lot of trouble.
Oh yeah, like I didn't post a lot about the stomach really, as to where the mastectomies or mastectomy and reconstruction after reconstruction came in.
Right.
But Dr. Tomei, who did my stomach surgery, said 7 to 10 day stay in the ICU, and I was like, okay, you know that. I was there for like 28, 29 days.
Wow.
Oh my gosh, a whole month. Wow.
Yeah.
That's hard with a 2-year-old.
But you were able to have your family come in and see you during that time?
At that time, because it was still pre-COVID. Okay. I don't remember everybody being there, of course.
Right.
But that's when I first came out. But my mom was able to come. My husband stayed with me. We had awesome support for the children. Even daycare was willing to take them home with them. You know what I mean? Like,
wow.
To help Josh out. Yeah. Like my friends threw together a benefit like beforehand, which helped with a lot of things because I was off for so long.
Right. Yeah. Financially, that's hard. Yeah.
It was. And like my husband, like he's never missed a day of work except for the birth of our kids. That was it. And he was in the next day. You know what I mean? So it helped out so much, and we were so grateful for that. And then what happened was they call it the anastomosis site, so where my small intestines meet with my esophagus, it was leaking, and we didn't know.
And you were
so when I started taking fluid in, which I couldn't wait to get my grape popsicle. I was actually prescribed a grape popsicle, and I wanted it. I was on not pain pills. I wanted my grape popsicle, but stuff was leaking into my abdomen everywhere. And I ended up, because I had a couple drains, they kept filling fast and fast. And like, to me, like I knew, like, well, that ain't right, you know, but and just go back to sleep.
Right.
I ended up developing a liver abscess and a splenic abscess.
Wow. Oh my gosh.
From the leak. It was
from the leak.
Wow.
They end up pulling the drains that I came out of surgery with. They end up pulling them because it was time, I guess. And then I still kept filling up with all this fluid, and I had one drain left at that time. And I remember being very restless that day, and I was in pain. I was sitting up and I was laying back, and my husband's like, "What's wrong with you?" And I'm like, I don't know, I can't get comfortable. He's like, "Do you need pain medicine?" I was like, "No, I just can't get comfortable." And Josh, sorry, my phone keeps. But we were laying there, and I was laying flat, and Josh was sleeping in the recliner next to me, but not enough that I could reach him. And I thought my lung collapsed at that time. There was this horrible pressure that just, like an elephant, crushed my whole body, and I like opened my eyes.
Probably talk or move, right?
I couldn't. I could not talk. I could not move, and I was trying to smack Josh, and I was gasping for air, and I couldn't.
Oh my God.
I thought my lung collapsed or something. Right. That's what. And I finally like knocked everything off my table, woke him up. Well, he ran out, and then my drain was black. You know, it was just so everything just ruptured at that time. So,
oh my gosh.
Long story short, they ended up getting me into the CT eventually after a while because I didn't have no pain medicine. Like my heart rate was in the 170s. Like I felt bad for the look in his eyes because he was scared to death, you know? And then being a nurse myself, I'm looking at these two other nurses in front of me and they gave each other a look. And I'm like,
You're like, I know that look.
I know that look. I do that look, you know? And he just could just rub my shoulder. That's all he could do was sit there and rub my shoulder. And I like mouthed I'm okay, but I couldn't get anything out. But I knew my stats, my oxygen saturations were going down into the 70s. Like my heart rate was 170 itself. I know, like, this is it, you know, like this is it.
Oh my God.
I was trying to tell them to rapid me. So they, you know, after all said and done, they put me back under to put more drains in me and started getting it. And I then, after that all calmed down a little bit, they hooked me up to finally a tube feed after I could finally start. I had a J tube and I wasn't tolerating that anyways. So
J tube is like through
right straight through the stomach. Okay, so normally they call it a G tube, but G's for gastric stomachs. Have that, so they went down further into my small intestine, placed the feeding tube, and I started that, trying to get some nutrition in me and everything like that. Well, I ended up just getting bigger and bigger and bigger, and I'm telling them, I'm not tolerating this. And they're like, well, it's new. Your body is getting used to not having an organ. Your intestines are straight, getting everything it needs right away, you know, and we were missing a whole digestive process. And I'm like, okay, but I'm not tolerating this, you know, like it's hurting. I'm bloated.
Your stomach was all distended. It wasn't absorbing.
It's huge.
Or digesting.
It wasn't. I end up having a blockage. So,
oh my gosh.
How long did they wait to find out that it was a blockage? Was it like a day or a couple days or
about 2 days?
Wow. And you knew that something wasn't
I knew, because I started refusing and getting like, I like to think that I'm nice, and like as being like on the other side of the healthcare, I was just like telling you it's not working. And then finally I was just like, it's not working. Like, stop my feet. Like,
wow.
And the day after the surgery, I had and they called it an NG tube, but it was straight down my nose for a while to keep, so I wouldn't get that leak and this abscess, but they pulled it a little soon.
Right.
So they were like, we have to put another tube in your nose. I said, please do it. Like, who begs for a tube to get shoved out of?
Right.
No. So they put the tube down, and within, once I was told that you won't have you can't throw up, like, you know, like have an emesis, like a vomit, like a projectile, because it's just not there. You don't have that stomach to put it out. Well, it happens, because as soon as they dropped it, it was just a whole bunch of.
It was all the blocked stuff in there?
It was black, it was green, it was just coming out, and they hooked it up to suction, and they carried away 3 big canisters.
Oh, that's how much they put in? Oh,
yeah, without me saying stop. You know what I mean? Like, I really need to. So, they kept that tube in for a while, which I was fine. I was fine with. Like, they said, we have to give your bowels a rest for a while. So they end up putting a PICC line in on my arm so I can get TPN, like nutrition, through IV. At this time, I wouldn't say I was fat when I went in there before all this, but I weighed a good 168, 170-ish. I'm 5'8", you know, so I was thicker, but I lost a little bit of weight then, but then I ended up swelling up so big that my husband's sweatpants were digging into, like, and he's not big, but like, he was bigger than me. Like, I'd wear his big sweatpants and they were digging into my sides. I went up, they never weighed me, but like, I ended up gaining an extra 20 pounds of fluid.
Wow.
So, and it was pitting. Like, it was like you push your finger and it would just sink in like dough.
Right.
And, so they did, like, I don't know how they didn't tell that I was gaining all this fluid, but it was just coming on. So they end up diuresing me. They gave me medicine to like make me pee all this off. I finally did that. But what, like 160th? I came home at 119.
Wow. Oh my God.
After it was all said and done, I didn't have any muscle. I didn't post those ones on there, but it was just, you seen every rib. Like, I used
In
to have
28 days, you lost 50 pounds.
yeah, like it was because they actually kept scanning me again for those abscesses, and they still weren't going away. So I had to drain after drain and staying and all this stuff. And I used to do like Tough Mudders, and like me and my friend were pretty active, and it was debilitating coming home and then with drains and unable to barely walk up steps. And therapy finally started coming. I couldn't even lift 2 pounds like on my ankle. You know what I mean? It was just like I looked at my husband, I'm like, well, this is just crappy. I said, sometimes hindsight, I wish I didn't know with everything, you know what I mean? But then I'm doing much better now. But like it was a long process of just getting muscle back on me and weight back on me, because I came home on tube feeds too. So I bought a recliner so I can stay seated up, because you couldn't lay down. It would hurt. And it was a battle. My husband could probably be a nurse now, but I gave
That's
him
so nice that he was so there for you. That's great.
How long did you have to be on the tube feed?
About 4 months.
Wow.
At home, 4 months?
4 months at home at night. And then once I started going back to work, I think I made my way back into the ICU. I want to say 6 months I made it back. But I was so malnourished still, like just stamina. So I would do a 1 4-hour shift a week, 1 8-hour shift for 2, you know what I mean? Like work my way back in.
Yeah, for what you went through.
They, cause typically I do 12s, 16s, and like you're running all over. And, it ended up being the ICU I just couldn't do, because I was losing weight again, and he wasn't going to pull my tube. The doctor who did Dr. He was not going to, he's like, Nick, you're not gaining any weight. You're going backwards. And I was like, next time I come in here, I'm putting an ankle weight in my pants. Like I'm getting this 2 pounds is 2 pounds. Like I'm getting this tube pulled.
Right.
And because when you work in the ICU, like you just can't eat when you want. You know what I mean? You just can't come out of a room, can't eat you can't come out of the room. When you would come out some days, like you were like Bueller, like nobody was around you, like to give you a break. And it's not fair to anybody else. Like it was just not the right environment for me right then. So I had to take a step back and end up just working on myself and gaining weight. And by the last month of everything, he cut off my tube feeds. He's like, it's on you now. I said, because I made a deal with him. I said, how about this? Shut off my tube feeds, because I hate them, and I just end up stopping them at night anyways. I said, which causes my husband. He's like, why is there still feed in here, Nicole?
Yeah.
I'm like, well, it must be the machine. I don't know. But he's like, But so I said, cut off my tube feeds. Give me a month. Let me gain weight on my own with everything by mouth, and then you pull my tube. Well, actually, I asked him to pull it, then I gain. He's like, how about we leave it in, and then you prove me wrong? I said, okay, all right, we'll do this. So he ended up pulling it finally, which made me like really nauseous. Just like, I mean, I deal with this on you guys, you know what I mean? Like, don't do it to me. He was like, well, if it falls out, you know what to do. Just put it back in. I was like, no. If it falls out, it's staying out. Like, I'm not putting it back in. So.
Right.
But after it was a year, I would say, before I finally felt like now normal, because my diet changed completely. I have a Dexcom that I wear for my blood sugars. I'm not diabetic, so that's a battle itself to get it approved, because I have low blood sugar now.
That came after the surgery?
After the surgery, because a lot of people was like, well, just eat sugar. And it's crazy, but
tolerate it, right?
No. Sugar drops my blood sugar.
Oh.
Because when your intestines are trying to digest it,
yeah,
it's pulling more insulin and blood sugar to your intestines, and my blood sugar just tanks.
Wow.
So I wear the Dexcom, which will alert me like, hey, you're going down fast, because I still don't feel hunger. I think I do. So it's a joke between us, me and my husband, because we go out to eat, and like I eat with my eyes or my head, I'm like, oh yeah, this sounds good. Oh yeah, that sounds good. So he's like, how can somebody be as small as you are, with the only one with no stomach, cost me so much money? He's like, I'm getting fat. And he was gaining weight along with me in the beginning, because like I had to eat every 2 hours. And he'd like, come on, time to eat. And he'd sit down and eat with me. Right. And he's like, you're making me fat. I'm like, well, I eat. You don't have to.
Yeah.
You know what I mean? Like, but
cute.
right? But like, he was eating my leftovers, you know, like a kid, because like I would sit there and think I want this, and then some things like you get a small portion of. So
yeah,
you know, but I told him
oh, that's so funny.
if we would go out to dinner, I would order a dinner, but only eat this much. And he's like, "You're so wasteful." Like not, and he knew, but I was like, "But this is my dinner, breakfast tomorrow, and lunch. Like,
right, yeah,
this will last me for a day and a half
right.
if it's." But now I eat like constantly. I like to think.
Yeah, and you can tolerate it.
I mean, I eat my wings on football nights, and you know, I was back in like I don't drink. Like I drink alcohol. Like I like my wine, but I don't do beer. You know, like you just learn things that you can tolerate and you can't tolerate. And I found out on a group on Facebook. Thank gosh, my sister and my stepmom added me to this group. It's the CDH1.
Mm-hmm.
Like, so it's support, and some things like they ask questions, because you wouldn't imagine like drinking plain water hurts.
Right.
Like I like to say you don't stomach it, but it hurts because it's the viscosity of it. If I have to put lemon in it, then it goes down so much smoother. You can't chug, like I can't chug. And when I can't drink, I can tolerate cottage cheese and just cheese like that. Like, but dairy anywhere else.
I've heard that. We've heard that a lot of.
And I've heard
places,
meat too. Meat.
I'm okay with meat. Like,
yeah,
I just have to chew it
a lot.
Because I'm a medium rare type of person.
Right.
So, like because one with my iron too, so I eat a lot of meat and do my IV infusions. But I watch him drink a big old glass of milk with like Oreos or something, and I just like snack on every once in a while because he's like Chuck.
Like, can you step in the other room, please? So.
Right, you know. But he calls me cheap because he goes out and buys ice cream for him and the kids, and there's like cashew milk ice cream and like all this other. But I'm not. It's like this big, you know. Like I'm not spending $8. I'll go without, you know. Like, but he buys me the cashew milk ice cream, you know. Just but it lasts me a long time.
Right.
And when all this began, I had to carry a lunchbox with me, which I still do. Like I pack it all the time. But when this first happens, like you have kids, they're like baby birds, you know. Like, what's in your mouth? What are you eating? Can I have a bite? Yeah, here. And my husband's like, no, this is your mother's. Like, she needs this, you know?
Yeah.
And I'm like that now. Like, before I'd be like, Kira, you can have it. Now I'm like, no, this is mine. Like,
it's my territory.
You guys
you need every calorie you can get, right?
Like, yes. So, and plus I'm supposed to double, like up to 4,000 calories you're supposed to eat, Dr. Tomei told me, because like,
4,000?
Yeah, because like, one, I'm not absorbing a lot of the fat anyways. I'm not absorbing a lot of nutrients, and I burn the calories faster than anything. And then you get so tired. Like if I eat like a carb loaded meal, like mashed potatoes, gravy, or like the Olive Garden, like pasta, I need a nap. Like my body shuts down, and I need a nap. Like I'll start
hard when you're working. Are you back to your 12-hour shifts?
Yeah, I'm 12, 16s, you know, like, so I'm back to that, and just actually started working out this past 2 weeks for the first time. I hit the gym in now it's like 3 years. I thought it was like 2 years. Like time just flew so by. So I went to the gym for the first time in like 3 years, and so out of shape. But like,
oh no, how did it feel? Were you like so sore? Like
very. Like I couldn't walk up the steps because we don't know. We did leg day the first day of the week. And we have a split level. So like I couldn't make it up the steps. Josh is like, go. I'm trying, you know? So, but maybe after a year after my gastrectomy, year and a half, I started feeling good as when the mastectomy came in. We had to get that done. I had small breasts anyways, like, and they were very, very dense. So it was so hard. Like they would see things, but they weren't sure. So biopsy and this and that. So we end up just doing.
When you said they see things, did they see shadows or lumps?
They seen shadows, and they couldn't. They asked if we should do biopsies, but doctors were butting heads. Like, well, why are we doing a biopsy when she should just be getting a mastectomy anyways? When are we going to do this? You know what I mean? Like, so I was always getting ultrasounds, and the time came for me finally just to go ahead and do the mastectomy. And they asked me if I wanted to go straight into reconstruction. They're like, which they felt was good at the time at that hospital. I had it because I was young. You know, they're like, I'm like, yeah, I'm still young. You know, I still want breasts, you know. I call them my foobs, but I had difficult with those because I had my mastectomy, straight into reconstruction.
When you
Came
say
home
straight to reconstruction, is that all during the same surgery, like straight to implant?
straight to implant. So I had two surgeons. I had the breast surgeon to do the mastectomy, and then I had a plastic surgeon in there to take over, like to come in to do the implant. I did the and then came home, started healing, but then I know it was always the left breast, starting to get real red, and I still had like discharge coming from my nipple, but I had no feeling. A crappy part too. There's no feeling in my nipple whatsoever at the time, and I noticed like because I would assess myself. You know what I mean? Like I asked Josh, like, look at this. Like I noticed this strange, so I called the doctor. He asked me to come back in, and they swabbed and stuff, put me on oral antibiotics, send me home. Well, not thinking antibiotics, some antibiotics are absorbed in your stomach.
Right.
The doctors aren't like, so it's always an issue.
Right, they're not tuned to having a patient without a stomach. Yeah,
correct. So, or if they have they think they have gastric bypass. So there's still, like, I'm like, no, like there's nothing there. And I had to end up going back in because it blew up red again. So I knew when I went in there that time, they hooked me up to IV antibiotics. And that's when I knew I'm not going home because they just don't give you IV antibiotics and send you on your way. And I at them, I'm here, aren't I? And they're like, yeah. And it was my son's first wrestling tournament ever.
Oh, that's awful.
So a lot of the depression started setting in because I'm like, I'm doing this to live, but am I real? You know what I mean? Like I've been missing out on all this stuff, all these things, all the, you know, I'm the one that's constantly in the hospital, anything like that. But I end up they found some kind of bacteria in there. So they end up taking it out, doing a wash on, giving me a new one. Months down the road, it came back. So they took
another infection?
Yeah. So they took it off completely. I had to be one boob, like uniboob, for like a good 4 months. And then they put an expander in because he took everything. Put an expander in to grow it again. And then put another set in. So,
that's so much for you.
And then at this time, this last set, he went bigger, thinking it would fill the nice hole that I have in the dip because I have no fat up here whatsoever. And I had to gain fat. The plan was to gain fat to do a fat graft up here. But it doesn't look. They were just so painful because they were just so big and hanging on by skin. And I end up, that surgeon was in Pittsburgh. So I end up having to go back to WVU for insurance purposes. Well, when I followed up with Dr. Tomei for my stomach, I do my yearly CT. Everything's looking good. And he asked me about that. And I was like, oh, I haven't talked to you in a year. And he was like, well, that's a good thing. He's like, but I was like, I already had my mastectomy. And he was very mad at me because why didn't you tell me this? Why didn't you tell me, like, we have people down here, you know what I mean? And he found out about all the complications I had. So I end up he sent me up with a great plastic surgeon and reconstruction on there. And this last surgery, she made me see a therapist. So she asked me, she goes, have you ever seen therapy for any of this? And I said, no. She's like, well, that's a prereq for me. I need you to see somebody to talk about what's going on with you before we even dapple into this.
Right. Wow. Like, what a great doctor.
Yeah. So she's amazing. So she ended up doing the surgery, and I told her, I said, I want to be small. Like, I don't need
this much.
Right. I don't need it. Like to this point, I'm over it. Really. Like I'm over it. And she actually told me that, because I told her about the sensation loss and all this other stuff. And then she was the only one to tell me if a trick to gaining sensation back. And I was like, it's been like almost a year and a half. I would have been working on sensation a long time ago, you know, but Yeah, and this was the last surgery, and it went awesome. Like, I'm smaller. Granted, I still have like the nice dips. You can tell when I flex, like they're not normal boobs, but like I'm happy. I'm out of pain. I am. It just 3 years to get to where I'm at now. So
Wait, I want to go back. So you got your sensation back?
Yeah, how did you,
I'm working on
what are these
slowly coming back.
exercises?
Oh, you're working on it. Okay.
Working on it. She's basically taking a cotton ball, and you just stimulate for 20 minutes.
Oh, a day?
All around your breast?
Just around the breast or right around. Well, I have feeling around the breast, but like the nipple itself and the areola, I don't. But she said if you just keep stimulating with a cotton ball, gently start coming back.
That's
great. What was her name?
Dr. Carrie Woodbury.
Carrie Woodbury. And where? What hospital?
WVU. Ruby Memorial. Yep, she's down there, and she's amazing. And her like PA, her physician's assistant, they're all just you have an app that you go in. If you message them, they'll get right back to you, or they call you. You know, it's just like not one and done. And then if I would need antibiotics and everything like that, there was a time where I came home with a PICC line because IV antibiotics are the way to go for me.
Right.
Like they tear me up, but they work. You know, I'm just not popping capsules, or if they do have to give me a capsule, we have to open it up and put it in applesauce.
Okay, yeah.
But like she figured,
even for like if you get sick and you need to be on amoxicillin or something like that, you have to do the same thing.
I think we get through out of the correct antibiotic for me. So if I get sick, but it's just anything like I seen a doctor back when I finally was getting back before the mastectomy, right after I was getting ready back to work. He said, well, your iron's low, of course. She's like, we should do some IV infusions. So she sent me up with the cancer center to get some IV infusions. And I met the doctor there, the oncologist. And I was highly upset because I don't think he even read my chart, because when I was sitting there and I came in and he was like, so you're here for some iron. I'm like, yeah. He's like, so why don't you just take an iron pill?
Oh.
And I was like,
I hadn't thought about that.
Yeah.
I was like, I said, sir, where's iron absorbed?
Right. Yeah.
And he was like, looked at me, and I said, I don't have a stomach. You didn't even open my chart, did you? And then I was done. Like that, I was just.
Yeah, you're like, I don't want to.
I'm not going to him anymore.
Right.
Yeah, so I was
I
done.
can't even read your chart. Yeah.
Yeah, he was just, and I had WVU on, and he's a Pittsburgh UPMRC, you know, so I was just like, he wanted to talk more about the politics of that. And I was just like, listen, I'm tired. Like, you're wasting my time and my copay. So I really need to go. So, but,
So how often do you do your infusions?
I haven't done them in a while. Like, to be honest with you, I don't think I've done them in the past year because I've been taking a lot of protein shakes, which is vegan protein, like pea protein. I can't stomach the whey. I take B12 injections weekly in my butt that I give myself. Yeah, I do.
You do it to yourself?
I give them to myself. Yeah. I'll do once a week for a couple months, and then I'll go monthly, and then we get it checked, and then I might have to go back to once a week again. But yeah, I give them to myself.
Oh,
so
really hard.
I kind of want to go back a little bit. So you said that you had some people in your family, but in the older generations, past your grandmother. So it didn't affect your mom or your dad. I don't know which parent.
Well, my mom got tested. Like it's not coming from her side. It's coming from my dad's side.
Okay.
And my sister did get tested for it. She's negative. So I'm the first one in the family to ever been diagnosed or found out with this. So as to where it's nice to know, because one, for my kids, you know what I mean? And then my sister got tested because of my niece and nephew, you know, or they still might need tested. I'm sure they do, because it's just, she's part of my dad, you know, like, so it's just crazy. And then my uncle, my dad's brother, and then my nephew, you know what I mean? It's just, do you want to know is the thing, or
we went through that. We're like, why do we even know? We felt that way for years.
Right. Because we have cancer in the older generations too.
Right.
But not in our recent. Yeah.
And I mean, I battle that a lot of times on the bad days. Like, why did I even find out? Like, I wish I just never You know what I mean? And we'd be.
What was your pathology?
Oh, so my husband was kind of upset about it because he just found out the other day because there was like a bickering fight going on with like family, like shouldn't have done it, should have done it, you should have done this. Well, they end up finding a spot in my when they took it.
Right.
So, and I never told anybody. Now that but he knows who's.
I did have cancer, honey. Like one.
Yeah, like I didn't do this, but some people thought I did it for vanity. You know what I mean? Like, you know, like, oh, she's skinny for a boob job, and it's not a boob job. Mastectomy, like, I'll repeat that over and over again, because they're not pretty. You know what I mean? Like, it's like, so they did find a spot, and my husband just found out a little while ago because, like, in my mindset, like, he went through enough. Do you know what I mean? I didn't.
Sorry, I'm turning my volume up because I'm having construction.
Oh, that's okay.
I don't know if you can hear that. Sorry.
That's okay. I'm going to grab my charger really quick too. But I didn't want to tell him because, like, he already been through enough. There was one less thing he had to worry about. You know what I mean? Like, it's fine now.
Was it in your breast or your stomach or both?
My stomach. It was in my stomach. So they didn't find any. My breasts were fine. Okay. Because I try to explain that to people too. Like, they're like, well, I'm like, well, it's lobular breast cancer.
Right.
It's not. It's harder to find.
Right.
You know what I mean? So,
but you also have the BRCA mutation, is that right?
Yeah. CDH1, the PALB.
Okay. PALB2 or whatever.
PALB, yeah, they found that, and then BRCA.
3 of them. So your risk for breast was huge.
Right. So.
And then PALB also does your ovaries, right?
Yes, that's what I started researching that, but then I got overwhelmed again. So that now that I'm better, I'm gonna, because I asked my gynecologist, like, is this something now that we have to worry about, because this is the last organs you could take before like everything else is like sufficient to me, like no gallbladder, no appendix, like now. So she said we'll cross that road. So this year, with my appointment coming up, then we'll discuss that. So I just want to go.
Did you have your gallbladder taken after you lost all that weight? Did you have to have it out?
This was way before. It was after my pregnancy. It went bad.
Okay.
And I was under. They BOGO'd me. They found my appendix slightly enlarged. They took it too.
Okay.
My mom's like, just take it, you know. So she couldn't. But yeah, they so basically every organ that you can live without.
So are you BRCA 1 or 2?
2.
2, okay.
Yeah. Sorry, 1 second.
Wow. That's a lot. There's a lot.
So they wanted, there was the doctor wanted me to hook up with like the NIH study, but I just never made it around to it.
Was that at the beginning or like now
they
want you to?
They could still do it. I can still do it now because they still need people to test and everything like that. I'm sorry, did my phone not rotate? There we go.
Perfect. Yes, you could still join the NIH. Oh, we lost her. Yeah.
There we go. Am I back?
You are back.
Yes.
Okay, good. I mean, I still can join and go down because they still want to do like the blood working and the tracing and everything like that. But it's still, I'm just finally healing. So it's a little overwhelming with everything. So I think like just.
You kind of want to move on and be done with doctors, right?
I do. And then like if I have the slightest, I don't want to say slightest, but like I get severe abdominal pain and to where I'm like crying on the floor and I don't know why. Like,
is that like dumping? The dumping syndrome?
I do get dumping, but no, it's not. I don't know what it is. It's not gas. It's just like, I don't know what it is. I don't go to the doctor. I don't go to the hospital.
Well, that's what Fad was saying the other day. He said his dumping doesn't have like going to the bathroom kind of stuff. His is pains.
Like sometimes I go to the bathroom and I'm like, here it comes. Here comes my dumping. Here comes my low sugar. I'm hitting the floor. You know what I mean? Because I carry around sub-Q or sugar pens and to give my sugar a boost. But like sometimes these stomach pains just come on for no rhyme or reason, but I'll tough it out. Like I'm not, because I'm over the doctors, I'm over the hospital, and they like to keep you when you get there. So I'm just like, nope, you know, so but I'm more in like, I'm doing so much better now. Like, and I just couldn't, like, the support of like my family and friends, like they're just amazing. And now it's just a new journey of gaining weight. So I never wanted to say that, but like now I need to gain
What's your goal?
weight. My goal is to hit like the 140s and stay at, because I'm at 138 now, but I need to gain muscle. I'm gaining like the fat, but then it just goes away so fast. And then like with COVID, I ended up catching COVID. Thank gosh it wasn't nothing horrible, because I'm like, you know, I'm vaccinated. Like I was really sick, just like the flu symptoms for like 3 days, but nothing too bad. But I log my food now. I'm trying to like, yeah, because like before I was like, I thought I was eating all day, and some days I was only like, I was averaging 700 calories.
Wow.
But I was like,
important to keep that journal.
Yeah.
Probably important to keep the journal too, to be like, oh, this caused me this.
Right.
Exactly. So, and then like, I think I'm pinpointing it down really, but there's sometimes where their body's like, nope, screw you. This is just what's going to happen.
Right.
Like, and then you curse a little bit and then you move on with it, you know? So.
Are you still doing therapy?
No.
Did that help? Yeah.
Yeah, it did help. It did. Because there was a lot of mom guilt, nurse guilt, because like I'm not as bad as other people.
Right.
So why do I need, you know what I mean? So
right.
It helped with, just because you're always the one that's so strong for your family. You don't want to look weak again, you know what I mean? Or that they did so much that it's just hard mentally and physically to keep like that portrait of yourself, you know what I mean? But like, because they worry about you. My family's constantly worrying about me. And like, I don't want to say one thing's wrong, because then my mom's like, what do you mean?
Right.
I'm like, no, I'm fine. Like, like I went down for an MRI and an ultrasound last week, and why, is everything okay? Like, I'm like, yeah, Dad, it's fine. You know, like I felt coming up the steps, you know, like I just want to double check everything, you know? So, but everything's fine. But it's always, I don't want to, I don't know what I'm looking for. Have them worry. Burden. Yeah, I want to say burden. Yeah, because I feel like I was a burden enough. You know what I mean? And I keep a lot of things to myself was what I was doing. But journaling or like writing down notes just frivolously, just to get it out. You know what I mean? And then I learned to talk to my husband more about how I'm feeling. And except for he's probably like, yeah, right, you didn't tell me about that spot, you know? But it's just a lot of self-care now too, learning to take my time. Like, this is what your body needs now. You know what I mean? Like, just, so therapy did help.
Good.
No, good. So. And I also was reading something in your, I think it was your Instagram, where you had to have stents placed too, or dilations.
Oh yeah. I went to like 5 of them. Strictures. So where the esophagus and the intestine, the scar tissue starts growing and it starts closing off. And soft food wouldn't go down, or swallowed food would not get down. It would get stuck. So you would have to go in there and get a dilation. Like, they put, it looks like a big hot dog balloon. They go down and blow it up and stretch you back out. And then.
While you're awake?
Oh gosh, no. They put you under.
Oh, gosh.
Yeah, they put you under. And then like, you're in a little bit of pain. I had it like maybe like 5 times. And they said it's normal because people just develop scar tissue different. And you might need multiple ones, but I haven't had one, knock on wood, like in a while. So it's been over a year since I had to have my last stretch done. So every once in a while though, I'm like, I feel like, I'm like, oh my, did I get stuck?
Yeah.
But it's probably because I didn't chew.
Yeah.
Because like, 30 something years with a stomach, you kind of like, in a nurse, you just eat fast and get on your way. You know what I mean? And so I'm still working on that. I'm still working on chew your food, you know.
I was doing it the other day.
I don't know how I'm going to do it. I
It's
don't
so
like
hard.
it.
And then you just find yourself swallowing it because I'll practice it later. But
yeah, that's like,
it's so hard. That's usually
right?
the hardest thing.
So then, I mean, it's just chew, but then you're not supposed to drink fluid while you're eating.
Right.
Because it fills you up. But you know what I mean? So,
yeah.
But I think your body just gets used to it again after a while. And then I still stick with softer foods, like the cottage cheese, to get my protein in. Love me some macaroni and cheese and mashed potatoes. You still got those carbs. But we try to do the steak. The steak, when I chew to make sure it gets down.
That's so hard. My dad said in the hospital for another surgery at NIH, they had blended steak on the menu. I've never done that. Yeah.
No, I just can't. No. Like I need to, it needs to be on my plate.
Right.
Like,
yeah. You can be able to see
it.
Yeah.
I need to see it. I need it covered with all the goodness. Like, yeah. So, and then a lot of soup. I've always been a big soup eater. Love French onion soup. Love it. But like, you need to chew it because it has all that cheese that you forget about. You choke.
Yeah.
Like, this is weird. Like I buy baby food. Like I have pouches. Like they're in my nurse bag. They're in my purse.
That's a good idea for veggies. Fruit,
then you
right?
don't have to chew it.
Yeah. Like I just if I start feeling crappy in the car, I just suck it down. Or like on Amazon, I get these Noka, Noka. They're protein, but they're kind of like yogurt, but like you keep them at room temperature. But like I don't know, they're super berries and all this other stuff in it that you need, and they taste good. So
cool.
And then like the apple oatmeal for like toddlers, like those little pouches. That's what I just use. So it's like it gets them in there, and it's not all that refined sugar either that I can just eat.
And that's good probably when you're at work too, huh?
Yeah.
Quick.
And then like applesauce or something instead of eating the apple and trying to like break down the peel. You know what I mean? So that helps. I still eat salads, but they don't get digested properly. But I still, and it's kind of defeating. It's defeating the purpose to gaining weight, but.
Right.
Yeah. So.
Oh my gosh. Well, it's so
wow,
good to
you've
know
been through
that,
so much, and now you're
on the other side of
it. I'm coming out of it. So. Yep. It'll be actually January would have probably been 2 years from the very first mastectomy, like the actual mastectomy itself.
Okay.
And then I just finished on my last surgery this was probably June of last year.
Oh, wow.
Yes, it was end of June.
So relatively recently, yeah.
Yeah, so that I was just been in surgery after surgery for these past couple years.
Yeah.
So we're just coming out of the other side. So 3 years today.
Good.
And then
it's a big milestone.
Yes, you've come so far.
I didn't even realize it was 3 times. Like,
And your hair looks so healthy and thick.
It does.
I started taking collagen in my things, but like I paid for some of this because it's falling out. Just letting you know. But yeah. But like no, it's actually getting like really thicker, and like I don't need it, but like
collagen. You should do collagen. You have problems with your hair, right?
Yeah, I take the powder tasteless collagen, Vital. It's like at Walmart, and I blend it right into my shakes, or I put it in my coffee.
Oh.
I want to also ask you about your bones. Have you had a Dexa scan?
No, that actually came up last night at work with another nurse. Because I know, like, you hit 50, then you have to have a Dexa scan. And my grandmother, who had the breast cancer, she had severe osteoporosis and osteopenia. Like, my dad hugged her one time and broke her rib. Like, she was bad. And it probably didn't help with chemo either. But, so I'm going to ask about that at this annual coming up with the ovaries. And then, because my mom, too, because she went through pre-menopause at 30. Like, and then I sweat a lot at night, and my husband wakes me up. He's like, "You're drenched," and I don't know if it's my sugar dropping or if it's just like all this stuff is starting to happen now.
Right.
You know what I mean? So that is, that's on my to-do list to ask about this bone density because I am shrinking. I used to be tall, like I didn't know I was tall until I got with my husband.
Well, they say that it's hard for us to absorb the calcium without a stomach. Are you taking the 1,500 milligrams of calcium a day?
I do gummies.
Yeah.
I do the gummies on top of the protein shakes that have the calcium in it. And I try to get like the chocolate chews, you know what I mean? Like instead of like the capsules and stuff like that. So, and I lay everything out, like everything is out above my stove, and right beside it is like my protein stuff. Because if I see it, then I'm like, oh, I got to do this today.
Yeah.
Right. So, and sometimes I even take my kids' vitamins, like when it's time for them to take theirs, like I take their, you know what I mean? It's not really good. Right, Flintstones, they've always were good. So I'm just trying to keep it up and keep it going everywhere. You know what I mean? So it's hard because when you don't feel it, like they say it'll come back. Like the feeling of hunger will come back. But I think it's more, of course, my stomach don't growl. Like I don't get those like, oh, I'm hungry. You know, I start feeling that, I'm tired. I'm hungry. I need to eat. Like I haven't ate yet. I need a little, so.
You're getting a different hunger cue.
You're getting a different hunger cue. My husband actually makes those like oatmeal protein balls with peanut butter, honey, and like coconut flaxseed, all that stuff. He'll make those in batches, and like I'll take those. You know what I mean? Like because they stay pretty good, like at work.
Those would be really good.
Yeah. So with chocolate chips or something in it, and like the perk about wearing a mask all the time is like people don't know I'm eating constantly under my mask. I'm just like they think I'm smiling with my eyes. Yeah, but I'm just chewing constantly. Like. Like before I walk in a room, I pop it in my mouth, like but yeah. I could tell you too that I'm not gluten intolerant now, I don't think, but I avoid it just because like the pasta, you'll learn like after I eat pasta or like bread, if you keep with it, your body will get used to it, but like it'll bloat me. You know what I mean? I'm just like, all right, I could shy away from that. Like I don't do, they're like, are you on low carb? You're just so skinny. I'm like, no, like I don't do low carb, but like I just like mashed potatoes are fine, but like a big sandwich or bun, I'll take the top part off, just try to eat the meat for the protein.
Unnecessary
it's
calories.
empty calories.
Yes, and filling. Like it's empty. Like you eat all that bread, and like you're not getting any nourish. I learned I have pleasure foods, but like eating is for living. You know what I mean? What does my body need to thrive now? You know what I mean? To survive. I need my vegetables. I need all this. You know what I mean? So I need to fuel my body instead of.
Right. If you have to chew for all that time in order to swallow it, you want to make sure you're getting some good calories in there.
Exactly.
That's a lot of work.
Exactly.
Yeah.
Yes. So like, I mean, my aunt made a huge peanut butter chocolate cheesecake. I'm taking that, you know what I mean? But it's just a bite here and there because I can't do it all like you used to, you know what I mean? Like it's a long adaptation process.
Right.
And then once you think you got it down after like 2 years, then you're,
it changes.
Right. Plot twist.
Right.
So, yeah.
Wow. Well, I'm glad to know that there is light at the end of the tunnel and that that food feeling comes back that you want to eat because that's my fear. Yeah.
There it is, and to be honest, it was a hard, dark time. Yeah. Like in the beginning. The beginning with all the problems and complications, regret. Because I'm living in a chair for so long. Right. My dream of being a flight nurse went out the door. You know what I mean? Because that's a lot of stamina and long hours. And just did I make the right decision? Right. And then when I look at my children, I look at my family, I look at like, I'm going to cry. But then I look at everybody that was there for me, for my family. Yeah. Like, yes, I have something to live for. You know what I mean? Like this wasn't out of vanity. This wasn't, it was a great decision. Yeah. And I probably would do it all over again. But I still you get those bad moments when you're like, damn it, I shouldn't have done that. Like you miss out on some things. Yeah. Right. But in the end, like, of course, the reward is it's life, like how my stepmom and my husband said it. So, and he reminds me all the time, like how beautiful I am, or, like, it's just, I'm like, well, good. We joke around. Like I told him he got a lemon. Like you got the lemon law. It's like, when you said I do, like, we didn't know what was going on, Right. So, but he's amazing. Like everybody is.
Oh, that's so wonderful to have that support. You're very lucky to have that. That's great.
And we're just working towards like small goals. Like I'm not running a Tough Mudder again because I've always hated them. Yeah. But I would do them again. Like, why do you do this for a headband and beer? But like now it would just be to be able to do like a mini Mudder with the kids or like, do something not as extreme. Like, so that's what I'm working towards now. Small goals.
Oh, good for you. So you're back in the gym training up for that.
Right. Yeah. My husband joked around. He said, like, from day, like, after all this, when it first began, I don't know. I think it's called an APB. Like, he's like, I put an APB out on your butt. Like, we need to find it. And I'm like, I'm looking for it still. Okay, it's coming. But yeah, like, it's nice. Good. All the support. So I believe it'll be fine. it'll be prayers and it'll be fine. Like just
One day at a time, right?
exactly. It'll one day at a time.
Yeah.
And then no regrets at this moment. Like no regrets.
Well, you're
so.
an inspiration to have been through all that and still
I
have this
know.
positive outlook and mindset.
Aw.
Very-
Thank you. Thank
very
you. Thank you so
inspiring.
much for giving me this opportunity too. Like,
Yeah, we're so glad that you came and wanted to talk to us and share your story.
yeah.
Awesome.
And then like you were Mountain Standard Time and I'm like, wait a minute, what time is that over here?
I know, you have to do the math. Oh, shoot.
Right.
We're on at the right time.
Hey Google.
Yeah.
We had
Yeah.
when we had our interview with New Zealand, I was like, this is so weird because they're like tomorrow.
Yeah.
Oh yeah.
It was
Yeah, they
very
are.
It was really weird.
Right. They are tomorrow. Yeah, that would be crazy.
Well, thank
Well, we
you so much,
appreciate-
Nicole.
Yes. Is there
No, thank you.
that you want to leave, share with us before we go?
Just that it gets better. Like it really does. And take one day, one meal at a time. Like, you know what I mean? One scan, just, you know, you'll find that you will, I don't know, if you're up for the mastectomy too, you'll eventually find the right bra. Like it's just,
Yeah.
it's, you know, like it just little at a time and just be thankful for the opportunity to be able to do it.
Right.
Yeah.
Do you know what I mean? That you're just not, because you're looking back at some family members or some people that
Didn't
you
have
wish they could have.
Right.
You know,
Exactly.
so
I think that's where I am right now. It's like
right. So
I have the
like,
opportunity right now to do it.
yeah. And then just so you just see all that other stuff, so you have the opportunity, and then
Right.
yeah. But yeah, thank you.
Thank you so much, Nicole.
Oh, you're welcome. Thank you.
Yeah, have a fabulous day.
Thank you. I'm going back to bed. Bye, guys.
Oh, good. Get some sleep.
Bye.
Bye.